Hello everybody, welcome to our presentation on effective leadership and empowerment in the nursing profession. I'm Beth, this is Marian, and this is Juliana. The problem we encountered is there is a conflict between the professional nurse and effective leadership management. Currently, we see authoritarian, task-oriented leadership that is ineffective in an environment of constant change. There is a need to empower nurses in the profession to enlist positive and effective change. There is a lack of empowerment, which decreases job satisfaction and organizational commitment and limits professional growth. The scope and significance we found in this leadership error are incongruent roles and responsibilities between management and the professional clinical nurse. There is a lack of understanding of values and priorities. Upper management often uses authoritarian leadership style, where the managers will solely make decisions and dictate tasks to the frontline nurses. Nurses, on the other hand, are confronted daily with complex patient care situations that require highly developed problem-solving skills and creative thinking. Nurses are often insulted when dictated rules that have nothing to do with outcomes of patient care. For example, attendance, dress code, and sick call policies. There is a discrepancy between how a nurse should behave on the floor and their independent roles with use of creative and complex problem solving, or blindly following rules from upper management. According to Huber, authoritarian leadership are leaders telling followers what to do and how to perform tasks. It stifles creativity and innovation. On the other hand, a transformational leader motivates followers to perform to their full potential by providing direction, goals, support, and materials. The transformational leader has a collective purpose and empowers the followers to improve through motivation. Cultural change is extremely difficult to achieve and can only be successful if the change will be perceived as beneficial for the person that needs to change. Motivation from leadership will play an important role in this process. This is the introduction to our literature review. As per Huber, the definition of a transformational leader is a leader or manager who functions in a caretaker role and is focused on day-to-day operations. Such leaders survey their followers' needs and set goals for them based on what can be expected from the followers. This type of leader focuses on maintenance and management of routine work. They motivate followers to perform to their full potential over time by influence a change in perception and by providing a sense of direction. They use charisma, individualized consideration, and intellectual stimulation to produce a greater effort, effectiveness, and satisfaction. Wooten claims constructive organizational cultures that enhance both employee satisfaction and patient satisfaction consist of work environments where members have positive colleague interactions and approach tasks in a manner that helps them attain high-order personal satisfaction and meet organizational goals. Leadership strategies associated with psychological empowerment are focused on meaning, confidence, self-determination, and impact. Race and Skis claim it is crucial to train nurse leaders today to exemplify the vision and values of the organization. Leaders pave a way toward making their staff feel valued by acknowledging, valuing, and recognizing the staff achievements.
Wheaton and Cameron are stating, by successfully accomplishing a task or resolving a problem, and by receiving feedback from a nurse leader, nurses have a chance to develop their sense of mastery. McPhee claims that personal reflection of a leader helps develop one's sense of self, which allow a better understanding of their own values to be in line with the culture of the organization. The recommendation we have is to implement a transformational leadership philosophy that creates effective leaders that have self-awareness, self-control, and are aware of views and perspective of their staff. Leaders that are focused on cultural goals and values. Empower leaders. In this program, we will promote better leadership by awareness and understanding of the transformational leadership, comparison of transformational leadership to other forms of leadership, also case scenarios and role-playment, and a mentorship and coaching from successful leaders to train the new management. Empower nurse leaders so they will be able to empower frontline nurses. The nurses will then have support, resources and access to information that they need. They will be more satisfied with their job and increase commitment to the organization. They will be motivated to meet goals and perform complicated tasks with confidence. They will have more trust and confidence in their leader, making it easy to comply and respect their recommendation and change. Our conclusion is to incorporate a unified empowerment theory framework that is guided by a formal transformational leadership development. This program will produce professionals who will be focused on further developing their professionalism, gain pride and accountability for their work, along with being respected as future leaders of the nursing profession. This in turn will lead to nurse satisfaction, decreased turnover, and overall increase in value and respect for the nursing as a leading profession. Empowered leaders empower nurses. Thank you so much for your attention.